Hello, and how are you? Today, I want to invite you to this conversation, and I want us, me and you, as Kenyans, to talk about the health system in the country. I want to say this. The health system in the country need a different approach because we have so many type of health insurances in Kenya. Leaders have theirs, police have theirs, pregnant women had theirs during President Kenyatta's time, secondary school going children had theirs. So there's a lot of type of health insurances in Kenya. But what I want to say and what I want to share with you today is this. The only way forward and the best approach for the Kenyan health system is to have something that is called publicly funded health system. That means that the health system will be funded by the government fully from the exchequer. That means when you get ill, it does not matter whether you have money in your pocket or not. When your child gets ill, it will not matter whether you have money in your pocket or not. All you will have to do is to go to your clinician or to the doctor, and no money will be asked when you get there. Not at all and never again. This is the only way that Kenyans are going to be supported well by the health system. You know, nowadays, members of parliament have their own health money. Senators, the same. MCAs, the same. So every time a person is elected, they are given a package for health insurance. How about the people that elected that person? You know, we must be honest when we confront issues and when we ask questions. What happens to the Wanjiku? What happens to Ali and to Amina down there who went and cast their vote? And then they do not have a fit for purpose health insurance. So when someone gets ill, it is going to depend on their pocket. We must depart from this kind of health insurance. This conversation is real, and it must be discussed in Kenya one time or the other, but the sooner the better. Ask MCAs how much harambes they go to, how much money is demanded from the MCAs based on illness, magonjwa. Michango iko kila mahali kwa sababu ya magonjwa. Leaders in Kenya know very well we have a problematic health system. MCA, they are at the front line. They are confronting these michangos and problems on a daily basis. They know something is wrong with our health system. And I am saying this. If we don't sort it now, going forward, we will continue to have more problems. I want to give you an example of America. America is 200 years old, okay? But the health system there is still problematic. Why? It is based on the insurance system as we have in Kenya. So I want to say this. America is not a good model to look at when we talk about the health system. Now, Kenyans, do we want 200 years from now to still be suffering from the health system that will be in place? The answer is no. So what we need to sort is this health system. Like I am saying, it has to be paid from one single consolidated fund by the exchequer. Every financial year, the exchequer will release the money that is needed for the entire health system. But we have to sort something about health devolution, okay? So health should still be devolved, but not through the county government. The health system must be a stand-alone system from the referral hospital all the way to the primary health care. It has to be a stand-alone system, not through the county governments. This is real. This is true. This is the only way Kenyan health system will be able to be sorted. This will mean that all counties will develop the same in terms of health. People in all counties will experience the same type of health system quality, not the one we have now that depends on how much money the county government want to put into the health system. Therefore, to me, this is the way forward. This is something I have even written about it 5 years ago, about the fit for purpose health system in Kenya. So today, I just wanted to actually share this conversation with you. And I also invite the national government, I invite all the county governments to listen to this conversation that we are having today, that the current health system in the country is not fit for purpose. We can continue to amend health bills, we can continue writing new health bills, but based on the current system, it will never work. We need a system where someone goes to the hospital without being asked a penny. So when you get ill, you don't have to think about what is in your pocket. When your child is ill, you don't have to think about what is in your pocket. The child will go to the doctor, you will go to the doctor, your mom will go to the doctor, your grandmother will go to the doctor, and will be examined, diagnosed and treated without being asked a penny, because the money for the health system will be collected nationwide through taxes. But when it comes to treatment, no one will ever have to ask you whether you have paid, how much money you have in your pocket, or this is the best way, and it's the best way forward. And that system is possible. It is overdue in Kenya. Now, I want to tell you this. By 2034, which is only 11 years away, Kenya will have 64 million people in terms of population. And in 2050, which is only 2050 from now, that is 26 years away, Kenya will have 94 million people in terms of populations. Therefore, if we are suffering now in matters of health system, God help us where we will be in 2034 and in 2050 as a country in matters of the health system. That is why this is the time, this is the opportunity to sort the health system once and for all. So as the population increase, the health system will be fit for purpose. Have a very good day. I leave you in peace. I'm gone.